speaking is important in everyday life, and the benefits of this course will extend much farther than just my personal professional field. Communication is a skill that I'll use for the rest of my life. I believe that public speaking matters in the medical field because patient-to-caretaker communication is important in order to describe the situation and research possible problems, prescribe and explain the treatment to the patients, and ensure the patient is well taken care of. When a patient comes into a clinic or a hospital, they normally have an issue that they need taken care of quickly. In order to get back to the health they want, they often go to a doctor that they trust. A good communication sets up a base that instills trust in both the doctor and the patient, and which is more important. According to Jennifer Fong in her article, Doctor-Patient Communication, a Review, she says, effective doctor-patient communication is an essential function in building a therapeutic relationship, which is the heart and art of medication. Patients must feel comfortable enough to open up about their symptoms and explain everything they can to help the doctor, which in turn helps them get better. The doctor must gather all the information they can in order to come up with an accurate diagnosis, give instructions to help improve the patient's health, and to establish caring relationships with their patients. After the initial diagnosis and research, the communication doesn't just stop. In Rebecca Say's article, The Importance of Patient Preferences and Treatment Decisions, Challenges for Doctors, she explains how important it is for patients to be involved in their personal treatment and therapy decision-making. Health professionals are increasingly encouraged to involve their patients in treatment decisions, recognizing patient experts as experts with a unique knowledge of their own health and preferences, their schedule and timetable for recovery, and their overall outcome. Increased patient involvement has been shown to be associated with improved health outcomes and enables doctors to be more accountable in the public's eye. This being said, those public eyes directly translate to the doctor's consumers in them being their patients. Doctors must run their so-called business a different way. Their consumers are their patients. Their patients may need the service more, but people have an abundance of options when it comes to their health care. They are more likely to choose someone that they trust and are comfortable with. In order to ensure a lifetime of health of their patients, doctors must be able to communicate with their patient as seen in McBride's and Marco's article in the Journal of Pediatric Hematology and Oncology. An effective exchange between a doctor and his or her patient helps them both see what the other person thinks and how he or she may feel. Knowing the symptoms and mindset of their recovering patients is a major requirement for healthcare professionals. I strongly believe communication is the most important aspect of a caring relationship for a patient. The patient should feel 100% comfortable with the diagnosis, treatment, and outcome of their lifestyle. With the combination of all these aspects, it's easy to see that communication is super important. Without explicit communication and understanding, the difference can be life or death, literally life or death. I believe that public speaking matters in the medical field because patient-to-caretaker communication is important in order to describe the situation and research possible problems, prescribe and explain treatment, and ensure the patient is well taken care of. I know for a fact that I will use the speaking skills I have learned in this class every day for the rest of my life, especially due to the fact that I'm going into the medical field.